Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have an interview that dives into the world of ankle braces.
Okay, so you say world of ankle braces, and it's actually really true. Because
Yes.
I feel like we think about ankle braces and we just think of that like old cloth lace-up thing that no one wants to wear.
That always looks the same. They all look the same.
Yeah, they all look the same. But there's so much more to them.
Yeah.
And I feel like we just take for granted just kind of like the ankle brace that's just like sitting in the corner.
Yeah.
Without really much thought about it.
Mm-hmm. And just kind of how it's designed and just, I don't know, you just kind of just, oh, well, just here's an ankle brace.
Right.
Yeah, so that's a good point.
So in this interview, we do talk a lot about typical ankle braces, the new form of ankle braces. We're bringing on someone this week who created their own ankle brace, which we did get to test out. And so we will share a little bit more on that. And really how they differ from tape.
Oh, yes. Yeah, we did broach the age-old topic of brace versus tape, kind of. So for this interview, we're bringing on Dr. David Kay. He is an accomplished orthopedic surgeon and inventor. He's the founder of OrthoHelix. He is in clinical practice at Crystal Clinic in Akron, Ohio, and is a professor of orthopedic surgery at Northeast Ohio University of Medicine.
So Dr. David Kay has over 30 patents, but the ankle brace specifically that we have gotten to test and play around with is the Vero ankle brace. And if you're interested after hearing this episode and seeing more about the ankle brace in purchasing or trying out your own, there is some information down below, and any of your purchases also help support the show. Whether you are interested in making your own product, whether you are interested in tape versus braces, or whether you'd just like to hear more about the foot and ankle complex, let's hear more from Dr. David Kay. So here on AT Corner, we like to pair evidence and experience. So let's kick it off with a story of what made you create the ankle brace in the first place.
Yeah, relatively straightforward. Tired of patients complaining about their ankle braces. It was a daily occurrence, and some people were just disappointed. Some were actually angry. Why were they angry? They couldn't wear the brace in a shoe. Their shoes were getting destroyed. They'd have to go out and buy 2 pairs of shoes, different sizes, to fit the brace into it. It was just a daily experience with the braces. A lot of people didn't like them. They were uncomfortable. And then getting through all the shoe fit issues on top of it. So it really made me question, are they actually wearing these braces or not wearing these braces? And why are we using a brace? And, what's the purpose of a brace? It really made me examine the whole process. And then getting together with colleagues, friends, we all had the same experience. And that experience would spread from basic clinic patients that you might see to high-level professional athletes. And nobody was particularly happy with their braces. They just didn't like them. And again, I think it's, how do we define a brace from an old style brace that you might have seen in Forrest Gump, the old polio double upright braces, which were just these rigid, god-awful things. But that's what we had, to just compression socks with special magical materials like copper in them that were supposed to do these fancy things that could never prove. To, again, what is the purpose of a brace, and how do you provide protection to an unstable joint or surgically reconstructed joint or freshly injured joint or somebody who doesn't want to get into those problems? How do we augment what people already have and provide that protection? And that led us down a pretty long course of discussion to identify the key elements as far as what we needed to have.
So kind of along those lines, what motions are braces attempting to limit, especially like the ankle braces?
Yeah, again, really good question. The ankle brace or the ankle is a inherently stable joint. It's a mortise and tenon. It's a square fitting side of a peg, basically, in a square hole, so to speak, as opposed to a knee joint, which is kind of flat,
Mm-hmm.
and shoulder, which also doesn't really have a very little bony um, support, versus the hip, which is like buried inside. And it's a very stable joint, even though it's a ball and socket joint, lots of muscles, lots of ligaments. The ankle is, again, inherently stable. But when we talk ankle, we're really rarely talking about the ankle joint. We're talking about the ankle hindfoot complex. And the ankle hindfoot complex will be the ankle joint, subtalar joint, talonavicular joint, and then the forgotten little brother, the calcaneocuboid joint. Calcaneocuboid and talonavicular joint are called Chopard's joint as a combination. But that's what provides all of the motions that we associate with the ankle joint. When there's muscle weakness, there's been some type of instability, there's just the shape of a foot or ankle where somebody's been born with that tends to turn inwards, or more of a cavus type shape, from a subtle cavus to a full-blown, really high arch foot. It changes the joint mechanics. And what we want to do is provide support so that we have more normal joint mechanics. And again, we're trying to affect the entire hindfoot complex, not just the ankle joint. It's more than two ligaments on the outside of the ankle, the anterior talofibular and calcaneofibular ligament. We have perineal muscles on the outside. We have peroneus brevis, which does one thing, and peroneus longus, which does something else. We have subtalar ligaments. Which are, again, the joint below the ankle. We have ligaments around the talonavicular joint, which is a ball and socket type shape on the inside, and the deltoid ligament, which has two components to it. Again, and muscles on the inside, on the outside. How are they coursing? How are those muscles aligned up? And then how are the muscles, tendons, and ligaments working together to provide stability, but still allow motion? We have to find that sweet spot between stability and motion.
Mm-hmm.
If we have too much, motion, that can change joint mechanics. Too much stability, then you have a very non-functional gait. And if you're talking about playing sports level and everyday activities, it's a problem. Or let's say you're working in a factory and you're walking on a bunch of crazy surfaces. You need to be very stable when you're doing that. Otherwise, you can get injured while at work, which can be pretty devastating. So, we need things working. They're designed the way they are through evolution. And evolution doesn't put things there just because, everything's there for a reason. Otherwise, it wouldn't be there.
Mm-hmm.
Everything that you said is obviously the foot's not going to change, like the anatomy's not going to change. But I think what is not talked about enough is the cuboid calcaneo articulation.
Yeah, again, where you'll see that, let's say in a flat foot, you get overload on that joint.
Mm-hmm.
And that joint will get upset and get angry. And it is a saddle-shaped joint, so there is motion that occurs in that joint. That joint helps to offload the outer side. If it's rigidly fused in a high arch foot, you're walking on the outside of the foot, and where are you going to get a Jones fracture? Okay.
Mm-hmm.
You're going to have bad perineal tendons because they're just in an abnormal position where the retinaculum, which holds them in place, is getting undue stress and strain on it. Now they're rubbing over bony prominences that they shouldn't. I've had patients basically tear the inferior retinaculum, and now the tendons are subluxing over the perineal tubercle, which is a sharp knife edge. And it's just rubbing on it as opposed to its proper placement. So again, you've got to think about what is it that we're trying to accomplish. And we want to provide stability, but we don't want to insulate it. We want those muscles getting the feedback that they should. We want the joints getting the feedback. There's these neat little nerves that around joints, mechanoreceptors that provide input. And all this is going up to the brain. And if the brain isn't stimulated, guess what? The brain starts to forget.
Mm-hmm.
And, you as athletic trainers, hey, get this guy back who's been in a cast for 12 weeks and needs to go back to work in a week or two. It's like, no, that's not happening, because the brain is forgotten. The muscles are severely atrophied. The skin changes. I mean, there's so many changes with prolonged immobilization. The flip side is we do have to immobilize to allow these tissues to heal properly, because they can't continue to take undue loading during that initial injury phase. So we have to find that right sweet spot where we're not over immobilizing, we're allowing healing to occur, if we're again talking injury or post-surgery, which is a different topic from the prevention of injury. Totally different topic.
Right.
So kind of with that, are there certain motions that you would want to try and limit more than others to try and keep that balance of mobility and stability? Like, are you trying to limit more inversion, or are you trying to keep them more in dorsiflexion? Is there like a preference on what should be limited more than others?
Yeah. I mean, one of the simple, which is oftentimes not recognized, is a tight calf muscle or equinus posturing. That puts the foot in a position of risk. You think about how basketball players or volleyball players, how do they sprain their ankles? It's not going up, it's coming down. And if they're tight, if their calves are tight, they can't absorb the stress properly as the foot lands. So they're now going to be spraining their ankle over and over again. Why? Their calf is tight. Just that simple. And it's just not the calf. Remember, it's the posterior compartment. And we've got a lot of other muscles in the posterior compartment. We've got the FHL, the tendon to the great toe, the power tendon. Very important muscle that has to allow the great toe to work well. If you look at the size of the FHL tendon, it is a big tendon. Again, we don't have big tendons unless there's a reason why we have big tendons. Posterior tibial tendon, a muscle, it doesn't have a lot of excursion. It provides a lot of stability, but that also can get tight because it's in the posterior compartment. Tendons to the little toes, it can cause clawing in the toes. And again, if you've got clawed toes, now your toes aren't working right and you're not fitting in a shoe well. So we have to have everything working together. This is different from barefoot activity like gymnastics, for example, or a lot of dances barefoot. We change everything. The discussion changes as we place the foot into a protective shoe. And again, that's a whole nother topic as far as the shoe. One of our criteria, going back to what I said before about the patients complaining, were the shoes. The trouble is the braces and the shoes weren't working together. They were working against each other. So you put a big chunky brace in, okay, it's nice and stable, and you try to put a shoe on, you can't put a shoe on, and now it's not working. And now you're compensating someplace else, and how much is going to compensate, and where's it going to compensate? Up the knee? Well, knee doesn't do what the ankle does, the hind foot does. Hip? Not really, but it's going to be forced into it. Low back? Yeah, it's going to, everything up the chain is now going to be placed into different stress and strain. And again, it's not just the joints, it's all those muscles, it's the fascia. I mean, think about all the fascia that we have. That's there for a reason too. Remember, evolution doesn't put something there unless there's a reason.
For sure.
Yeah, I think we've all had that experience of someone complaining about a brace.
Yes, most definitely.
Yeah, well, again, what is it that you're trying to accomplish? And we knew that people were going to go through different phases and have different needs. And that's why on our brace, it's modular. The stirrups can be removed or not. It's on the individual's call as far as what they need or what they're after. Do they need more stability? Do they need more of the dynamic nature of the brace? Again, it's a very different concept than what's currently, on the market and everybody's used to. Having something dynamic is not the norm It's the more rigid devices. And you think about a lot of people, they just don't want to wear something rigid. It just
Mm-hmm.
doesn't
Right.
feel good. Yeah, they feel stable if they take a few steps around, but then go ask them to go play a sport that involves cutting and jumping and all, and they can't really do it well. They don't like them, so they don't want to wear them, even though they may need that extra support, or maybe they have some concerns, or maybe they've had a prior injury. And you think about chronic ankle instability, the numbers of people who develop chronic ankle instability after their first ankle sprain is significant.
Yeah.
And rehabbing that person can be difficult, just because, again, you get some brain changes. And, the flip side is there are people who mechanically can be quite unstable, to an exam, but because they have very strong muscles, because their foot can be placed into normal motion with dorsine and plantar flexion and inversion, eversion, even though they might have some extremes, their muscles are great. They have no symptoms. So just because somebody has some degree of instability, and there's a lot of D1 athletes who have unstable ankles, but they have no problems because they've been rehabbed properly. Their muscles are nice and strong. Critically important.
Mm-hmm.
So we don't want to impair and impede through treatment of a problem and creating another series of problems.
You brought up a really interesting point about the difference between demands barefoot versus in a shoe.
Mm-hmm.
Yeah. Again, you look at the trend today in shoes. It's these hyper cushy shoes.
Mm-hmm.
And the way, when patients would ask me, what about the shoes? I go, stay away from the hyper cushy shoe. It's like you're running on a pillow. Your foot's going all over the place. Your muscles are doing all kinds of crazy things. It's absorbed, all this energy is being wasted with these hyper cushy ones. That being said, there are also shoes that have been designed to absorb energy and release energy and actually function in that particular activity. I mean, we've had a world record set, a couple years ago in a shoe that was designed to be dynamic.
Yeah.
That didn't happen because we had static, old Converse lace-ups, right? But so again, we have all these extremes, from barefoot running to these hyper-engineered shoes to these pillows that people are strapping on their feet and trying to do stuff with, and they're kind of falling all over the place. And it's again, not a fan. I want our bodies to function the way our bodies have been designed to function. We want to provide some augmentation and some support. We don't want to completely insulate. And on both extremes, from too rigid to too soft. Again, we want to Goldilocks all this just right.
Absolutely. And that actually brings up an interesting topic about like the increased amount of padding. There's also, from what I remember hearing, a lot of receptors on the plantar surface of our foot. And when that gets bogged down, that could really cause a lot of issues of understanding your foot in space.
Yeah, I mean, our feet are so rich in nerves. Our skin, the skin on the sole of the foot is so specialized, incredibly specialized skin. You think about the forces that are being placed across it, not just direct forces, but all the shearing. And our skin holds up, and again, until we get extremes. Blisters are a problem. So why are blisters happening? Maybe you got a shoe that's just too big and you're slopping around inside the shoe. Again, we don't have a shoe that's fitting right. Maybe there's so much sweating going on that that's causing problems. So yeah, the skin on our feet is really, really specialized. There's no other skin quite like it. And that's why when somebody has an injury to their skin or to the padding on their feet, it can be absolutely devastating. One of the problems with crush injuries around the heel is that the heel pad can get severely damaged. And if you look at a cross section of that tissue, it's all these tiny little shock absorbers with fat in it. You blow those little, septae out, and guess what? You're not absorbing shock well as the first line because the heel pad is not functioning well.
Yeah.
I would see this after multiple cortisone injections. And you see this with aging, that the padding changes a lot. Again, that's your first line, skin, and now we've got this specialized padding. How is that interacting? Again, you wrap a foot in cloth and canvas, and now that tissue is going to function differently.
Mm-hmm.
The line's about Mother Nature, so don't fool with Mother Nature, and that's what we're doing.
Mm-hmm.
And again, let's think the process through.
So an age-old question: how does tape differ from ankle braces?
Yeah, so taping has been the go-to. I mean, athletic trainers are, it's we got to go tape up the ankles, and probably when your first year, it's like, oh, that's fun, and by your fourth or fifth year, you're like, oh my God, I got a football team to tape. I'm not going to do anything else but type besides tape an ankle and then retape an ankle and then take tape off of an ankle. And what am I doing with all this tape? And oh my God, it's just like awful. So yeah, tape does provide stability. There's a lot of athletes, trainers, and worse are coaches who, haven't read anything new about training, goes back 30 years ago. And training has changed pretty dramatically. Mm-hmm. And they want everybody's ankles taped. And it's kind of like, okay, that's going to get loose in about 10 minutes. Mm-hmm. And if it's really hot, it might even be faster than 10 minutes. And that means it's not doing anything anymore except tugging on the skin, a little proprioceptive input. Mechanically, it's not working. And they're going to come in here and I got to tape them back up again. I got to tape the shoe onto them. And now that's not going to work right. And it's just this stiff thing that they've got at the end of their leg that they've got to cut on and jump on and can't really move. The heel lock that you've all been trained on, it sounds really good, but people do get a lot of skin cuts, and a skin cut on the bottom of the heel is painful. And now they're not going to do anything. And then you got to maybe shave the leg. I mean, it's just a lot. I know one of our team members is Dr. Robert Anderson, and he had been in charge of the musculoskeletal part of the NFL. NFL has done a study, and basically, no more tape, go to braces.
Oh, interesting.
Yeah. That's a pretty recent study. I'm not sure if it's been publicly made public yet, but it's the recommendation is go away from tape and get to braces. Mm-hmm. And the tape manufacturers they're not particularly happy because tape is heavy and shipping costs, and you guys have to lug these big heavy boxes of tape around, and it's like, okay. And then you got to do all the cleanup on them too, which is pretty nasty after every game. It's very expensive. The cost of taping, two taping for, let's say, half a team for a game. Yeah. That's a lot of money.
Yeah. We're talking thousands.
And I think all of you as trainers would rather be doing like training and not taping. Mm-hmm. Yeah. Where's your time being spent? It's not really utilizing your knowledge particularly well.
Right.
Yeah. Yes, maybe, but maybe not. Maybe there's better things you could be doing.
Right. I mean, during football season, I say maybe an hour, sub-hour.
Oh yeah.
A good amount of time is spent of my day just taping, and there's a time and a place for it, but it is definitely it can get excessive and expensive.
That's the big one.
Yeah, I mean that's one of the things. Yes, braces can be expensive as a one-time, but if you get a season or half a season out of a brace, you've more than paid for what the taping costs would be. Mm-hmm. And clearly, you've got to think about it. Everybody's being cash strapped. There isn't money for schools, so they're cutting somewhere. And then if you ask parents to go out and buy them, they want to get the right thing, but they don't want to necessarily spend $200 on a brace. Yeah. But the simple, really cheap compression socks don't really do much, for $10, and they're not going to hold up real well. So again, we've got to find something that holds up well enough. Our brace being made out of elastomer is waterproof, so that's helpful. Yeah. Remember, it's a rubbery material. And one of my favorite little videos is he's a linebacker, NFL linebacker. He just said, doesn't get soggy. Yeah. And again, that's a real issue depending upon, where you are. You all are out California. It gets hot. It's really, really hot. So that's what's, that's important. What's the climate that you're going to be in? Where are they playing in? Games don't stop just because it's raining like crazy. Or if it's hot, so they're going to go through an awful lot.
Right.
Absolutely.
Not to mention the difference between when people tape with a pre-wrap or tape without a pre-wrap. And we basically call it, when people tape with a pre-wrap and it just gets soggy and wet, we just call it a wet sock at that point.
Yeah. It's I know these things might individually, they might seem little, but collectively you start adding all this up, and it just comes to, why won't they even consider wearing a brace? Because it's just more trouble than they feel that they're getting benefit from. And they might be saying, I'm not getting any benefit from this. This is not helping me at all. And I feel this is hurting me. But so are chronic little ankle sprains all day long when you're just activities of daily living. I've had patients in braces say, I sprain my ankle once or twice a day and I'm wearing a brace. I was like, okay, you need surgery.
Yeah.
And if you think about, the surgical approach that we do now, it's getting clearer and clearer that an augmentation to an old operation, the Brostrom procedure, which was described in the early 1960s, which is a primary repair of the ligaments, that the augmentation, and you can choose your material to do the augmentation with. I have my own preferences, but the idea is, hey, so we can move you faster. We don't have to rely just on the ligament, which sometimes I've opened up enough ankles and go, there's nothing there. It's gone. There is no ligament. And, those tendons look terrible too. And because they're not in the proper position. And the inside of that ankle is getting all worn down because that ankle's been slopping around and banging. Too much shear forces on the cartilage. So these are things that do happen. We want to avoid. And I think it's more of a comprehensive program. People are at risk in certain sports. You think about lacrosse players. Actually, the worst are netball. Do you guys know about netball?
Mm-mm.
I've heard of it. Yes.
So netball is played in the UK Commonwealth. I actually met the English netball team when I was giving a talk in Australia, kind of stranded in Melbourne, and I met them, and I started fighting about them. And one of our team members is Mr. Anthony Pereira. If you're a surgeon, if you're a board certified surgeon in the UK, you go from doctor to Mister. Netball players, 70% will sprain their ankle during a season.
Wow.
And netball, think of basketball, but no backboard.
Yeah.
It's just a hoop.
Oh, wow.
Okay. It's just a hoop. That's all it is. But 70% are going to sprain their ankles during a season. That's a lot. Think about lacrosse. We could talk the differences in a grass field versus a, artificial turf. And there's problems with both. Yeah, pros are going to play on neatly groomed, perfect grass fields. But think about those junior high kids who are playing in mud pits and, it's holes and all kinds of stuff. And they're constantly spraining their ankles just because they're running on these incredibly uneven surfaces. You think of the military, military, they're on incredibly uneven surfaces, and ankle sprains in the military are a big problem. And it has to do with the surfaces that they're on that are just so uneven. They're carrying a lot of heavy packs. It's difficult terrain. It's difficult to navigate. Again, you don't want them perfectly stiff because they're going to hate it. It's just not going to work right. But they need some type of little extra oomph that can help them.
Yeah, for sure. So, how do you get, we know tape is just going to become a sock after a few minutes. And we know, again, braces tend to be fairly bulky. How do you create kind of buy-in for an athlete to wear an ankle brace?
Yeah, we actually spent a lot of time on that. So again, another one of our primary designers is Ned Amendola, and Ned is he's current president of the American Academy of Orthopedic Surgeons for another week or so, and yeah, that changes next week. And past president of the American Orthopedic Sports Medicine Society, and he takes care of sports medicine at Duke. He had also been at Iowa, and the first thing he said is it's got to be comfortable. He just made it absolutely clear. He said, I can give them brace and they're not going to wear it if it isn't comfortable. So we had to make it comfortable. So that's a combination of the material and the design. You've heard me kind of say the trouble with a lot of braces is if they completely close everything in. Well, if you got an acute ankle sprain, it's hard to get a brace on because you can't contort your ankle well. I mean, you're just like twisting it and it hurts trying to put the thing on. And now it's covered in cloth, which really doesn't provide any compression underneath it. And it's not going to fit inside of a shoe. Again, back to the shoe fit issue. So we purposely are open in the back. Why? It's just easier to put on. You think about the old rear entry ski boots, that were out. They were easy to put on. I mean, you just kind of slide them in. Okay, great. It's on. And again, with our brace being open in the back, it helps protect the Achilles if anybody has Achilles issues. And you're still wearing that comfy shoe like you did before, the one that you feel good because it's not taking up too much space. So using, again, design and materials, we're an elastomer. So being an elastomer, the hardest part on shoes is a foot is three-dimensional. You go length, width. Well, there's a lot more to it than length and width. You can find some skinny feet and in a size 10 and some big, chunky, heavily muscled feet in a size 10. Those are completely different, feet. And the cloth and shoelace can be hard to fit around. We're an elastomer. We can wrap around it. And we chose the durometer that allows for some stretch. We looked at 3 different types of durometers, which is hardness in an elastomer. Think rubber bands. Some are hard, some are really soft. Some stretch easily, some don't stretch so easily. So we had one that was really comfy, but it was just too stretchy. And then we had one that wasn't stretchy, wasn't real comfy, very supportive. And then we chose the one, the Goldilocks, the one in the middle. So that was, again, through design and material choice. Elastomers are a fascinating material, which haven't been particularly well leveraged in bracing. But again, let's go back to rubber bands and balloons. Some rubber bands give a real quick snap back, and some it's like, wow, it barely snaps back. You can actually choose those material characteristics, okay, on how much rebound you get. So very different than the discussion about the statics that don't really do that. They're just kind of there, and now you're rubbing and back to blisters, back to, calluses where it's like, why do I have a callus all around here? Because it's just not fitting properly. And these are all off the shelf. So off the shelves are not going to fit everybody. There's no single brace that will fit everybody. And I've had patients complain about custom made braces from molds of their leg. Why is that? Well, yeah, it's their foot and their leg in a position. It goes through different positions, right? And it might fit great in one position and then moves to a different one. It's like, oh, it's not fitting real well because of the joint mechanics, because of the muscles, because of, again, back to the shoe. How is everything working together? It just needs to all work together. Again, we spent a lot of time on this trying to come up with a design, but our number one was it had better be pretty comfortable, at least for the vast majority of people. And there's always somebody who's not going to like things. That's just how people are, right? You can get 9 people raving, oh my God, this is the absolute best. And one person, oh, this is terrible. And it's just like the same thing, right? So, again, you're never going to get anything out of a box that's perfect. And that's why I think it's so important to, again, go back to the premise of what are we trying to do?
Mm-hmm.
You know, what is our goal here, and what's the good and what's the bad? Because there's both.
Yeah.
Regardless of what you do, there's going to be good and there's going to be some bad.
Mm.
It's a trade-off.
And yeah, and all of you as athletic trainers, you know, it's you need to do what you've been trained to do because you know that it does make a difference for people.
Mm-hmm.
Athletic trainers and therapists want people out of braces as fast as possible because it protects you too much. It's going to make you weak, right? You guys have probably said that.
Mm-hmm.
You're going to get weak if you wear this too much. And I think it makes people weak. It changes their gait because it's not allowing normal, you know, body function.
Mm-hmm.
It's, you know, all those lectures that you had on kinematics, you can't really do it when you throw them in a rigid brace.
Yeah.
Right.
Yeah, absolutely.
You know, I'm really fascinated by this idea of you having this idea and then taking it and making it real life. Can you talk a little bit more about like how you really made this idea come to life and what were the steps
Mm-hmm.
in that process of actually creating this brace?
Yeah, it was extremely complicated. Okay. I can start there. It really was. You know, people go, oh, it's just a brace. It's like, kind of, maybe, not really. You know, if we wanted to make a brace that looks like everybody else's brace, you know, that's easy. That's not. But we just said we need to change. You know, our surgical principles have changed, but we're lagging behind. It's a little bit like saying, okay, we're going to put you in a cast for 12 weeks, and no, you don't need to see a trainer. You don't need to work with a therapist to get your leg back to where it was. It's like, no, that doesn't work too well. So we started on it. We went to one industrial design firm and to work over different designs, different shapes. Prototyping is very difficult to do in this material because when it's poured into a plastic mold, the material actually is different. This is injection molded, so it's made from a mold. And when it's poured into a plastic, you can take the same material, put it in a metal mold, which is what's used for production, and it can be very different in its characteristics. So we had to spend time on the shape. And once we were satisfied with the shape, we then had to then go to make a mold out of metal. But it wasn't quite right. And that was a very expensive learning experience because these molds are very expensive. And we ended up working with another industrial design firm that had experience. They were the ones involved in designing the reaction knee brace, which is also an elastomeric brace. That was designed more for fitting. We were a combination fit and function. Those were the two key elements of why we went with the elastomer. And again, we had to really run through different prototypings, changing this, changing that. We have two ankle straps above the ankle. We felt it's very important to have what's called a supramalleolar suspension. Everything needs to attach above and below. Below, it's going to be inside the shoe, but above, you need a good attachment point. And, you know, for an example, we have two straps. Why two? We had initially two, and we tried one because it was easier. Technically, it's just a lot easier to use, you know, worry about one. The trouble with the one strap is it would rotate the entire brace. And now it's like, okay, it's not fitting quite right because of the rotation when we would tug on it. That's going to be a problem. So we traded a little easier to use for better function. And that was actually that was one of the most difficult decisions that we had to make. Strap placement so that we could control the foot, not interfere with the shoe, provide support inside, outside. The one good thing we found was that our brace works right or left. It's not, we don't have to have a right and a left. So let's say if you guys are carrying the braces, you know, you've got 3 sizes and that will take care of, typically like down to like a size 5, you know, women's 5 up to a men's like maybe 15. We have basketball players, big guys, 6'5", 6'6", 6'7", who wear a medium.
Wow.
Oh, wow.
Nice.
Okay. So again, back to why it's so difficult, because the foot shape in 3 dimensions is so variable, so incredibly variable, but you want a nice snug fit. And how our brace goes on is very different. Again, it goes back again, all the time we spent on prototyping, where the cutouts were going to be. We wanted to be able to wrap around the foot and make it snug, just like a band. Everybody uses bands now. Nobody can claim they don't know what a band is, but a band doesn't do anything until it gets tension, and our brace functions the exact same way. Another element to our brace is we have in it. So if you're stirrupless, we have what's in it called a living hinge. If you look on the inside, outside, the bimalleolar axis, which would be the medial malleolus to the lateral malleolus, there's the ankle axis. Well, I tell you, so the two of you and myself, we have different bimalleolar axes. But if you think about the braces that are hinged, you're stuck with one. It's not adjustable. But we have a living hinge. So it's large enough, it's adaptable enough, it has cutouts and stress relieving points over the bony prominences. Again, one of the complaints we heard was these stirrups hurt. Yeah, they hurt because it's a solid piece of metal or a solid piece of plastic, and it's rubbing on the bony prominences. We have a cutout in the stirrup. We have a cutout in the actual brace to adapt better over the bony prominences to make it more comfortable. So again, if it's not comfortable, nothing else makes any difference because nobody's going to use it.
Yeah, that was something that we noticed it was very comfortable.
Yeah.
And one thing that I noticed, especially like in the dorsiflexion aspect, is it wasn't like pressing on talus when we tried it on.
Yeah, that was good.
Yeah. Again, the strapping, you can change what you do. We've used it for symptomatic flat feet, where you can pull the foot in and it provides a sling under the talonavicular joint, and can actually help to protect the posterior tib tendon, the spring ligament. It's in there. It can adapt to that high arch foot and pull the foot where you might want it to go. Noticing again that we wanted it placed in dorsiflexion. Why? Because the back of our calves are very strong and they're going to push down on it. So it will actually help bring the foot up out of that danger position we mentioned earlier of being down and in with landing. Again, the takeoff is easy. The landing is the hard part. And I mean, think how many activities, whether it's dance, volleyball, basketball, tennis, it really does make anything where people are jumping, and landing. Again, it's the landing. You guys work with, when you're doing your athletic training, you're working on landing. You know how important that landing is, and the shock absorption, and the foot has to be in the right position. Why? Number one, you don't want to get injured, but just as important, you're not standing still. You're not just jumping and just, becoming a statue. You're moving to your next, you're doing something else immediately. And if you cannot be properly positioned, you can't move again. And you can't move with fluidity, which is, the hallmark of an athlete, right? It's fluid motion. Well, if you can't, again, if your landing is off, you're not going to go anywhere. If you're not absorbing the shock well, if you don't have the eccentric strength to absorb the shock of landing, real important. And you guys work with them, and the last thing you want to do is put them into a device that's supposed to protect them. They go, I can't do that anymore.
Yeah.
Right. Ready for the action?
Yes, I think we are. Go for it.
So here on AT Corner, we like to do an action item just to wrap up, something that someone can take away from the podcast today. What do ATs need to know about selecting an ankle brace?
Yeah, again, I think going to just a generic type of brace is probably not a good idea. Take a look at the person, take a look at the activities. What are you trying to achieve? Is this somebody with chronic ankle instability? Is this somebody who's post-injury? Is this somebody that is just going to be at risk because of the nature of what they're doing? Those can be very different criteria. You think about an offensive lineman versus a receiver. Okay, a wide receiver. Those are really different activities. And just because they're playing football doesn't mean they need the exact same brace. Very, very different. Stresses and strains on across their ankle. But they all need the same thing. They need to function. And what you don't want to do is make it so that they can't function anymore. Yeah, they're really stable, but they can't function. So think about, what it is that they're doing. What are you trying to do? What is your goal? Instead of just, we're just going to put you in a canvas lacer with shoelaces that, looks like it's from the 1950s. Oh, it is from the 1950s. I mean, we've changed sport. Sports medicine wasn't a thing back when these came out, right? It just wasn't. Now it is. Now we have a lot better information. We have better knowledge. So, just individualize the treatment. I think that's what's important. Think about what it is they need. It's interesting in the NFL. Their equipment has RFID tags because they're given very specific equipment. And when they go out to play, they're scanned and they better have what they've been told to use.
That is really cool.
Yeah, that's crazy.
Yeah, but think about, with NIL, I suppose good and bad. Part of the bad is that they might put something on just because somebody gave them a whole bunch of money.
Give them money,
Yeah.
But it could be absolutely the wrong thing. And now you're going like, why are you wearing this thing? Why are you using this? It's not a good idea. I mean, they wouldn't do that with, the helmets to prevent concussions, right?
Oh, right.
I mean, think how that's changed.
Yeah.
And that's pretty recent. We're talking the past few years, how helmets have changed pretty dramatically. And, it's like, no, you better be wearing the helmet we put you into because there's a reason for it.
Yeah.
And, that's another thing. Can you afford the expensive helmets for the contact sports and tape everybody's ankle up?
Yeah.
Where are you going to put the money?
No, for sure.
Also, I'm just thinking time. Like if we really actually could convince a team to brace instead of tape, how much more useful could I use that time to actually do a second round of treatments?
Yeah.
Rather than an hour of taping.
Yeah. I mean, I think as mentioned that earlier, you can't do what you need to do because you're kind of doing this
right
mundane type of activity that somebody wants, and they're not thinking it through either.
Right.
That they're not considering. Yeah, if somebody's never had an injury and they get hurt while they're playing, throw some tape on them, right? Okay, because you get that taken care of right then and there. Yeah. But just think it through a little bit. And I think the hardest part is probably bringing some of the coaches. I mean, this is my understanding is that the coaches, they need to get out of the old stuff and get into where we are now.
Right.
Oh, 100%. It's always back in my day.
Yeah.
Hear that one a lot.
Back in my, well, that's changed. I mean, back in your day, you probably were measuring heart rate variability to see if somebody's getting overtrained, right? You probably weren't doing that. And now, guess what? You're going to measure heart rate variability and go, you're taking it easy today. Oh, you're good to go, right?
Yeah.
I mean, because they haven't had proper recovery. And without proper recovery, they're going to get hurt. And that's going to be a problem. So, back in their day, they didn't do that.
No.
Yeah. You got to get that buy-in because otherwise they're just going to say, oh, well, that's just being soft.
Yeah.
No, that's being smart.
Through all of that stuff.
Yeah. That's being smart. That's allowing your players to be the absolute best. You think the Olympians that we just all watched are soft? I don't think so.
Yeah.
Okay. And they get rest. They get
Correct.
training that's very different. Their equipment has been absolutely optimized for them and for the activity that they're doing so they can perform the way they perform.
Absolutely.
Every little bit makes a huge difference. You just look at the speed skaters and how their skates have changed pretty dramatically.
Yeah.
Getting back to those running shoes that absorb energy. It's completely different. So, let's use what we know to do today. Hope that helps.
Oh yeah, absolutely.
Well, this has been really awesome, and we learned a lot more about ankle braces. It's kind of something that you kind of think is pretty straightforward until you actually do
Deeper.
a little deeper dive into it.
Yeah.
So thank you so much.
Yeah, thank you, Dr. K. I appreciate it.
Yeah, thanks for allowing me to chat about this. It's clearly it's a passion. It's managing what's going on is collaborative. You can't do your job if I don't do my job, and vice versa. And everybody in the chain needs to work, and we have to decide what is the common goal. What is it we're really trying to accomplish here? And there aren't very many Olympians. There are a lot of people who want to be active and want to stay active, and that's what we're encouraging people to do.
Absolutely. So what I liked about our conversation was the fact that they're tackling this problem with like a different mindset. So I think that was just really cool to take what's worked, what hasn't worked, and like try to answer those problems with just like a different frame of reference.
Well, honestly, I feel like, again, like I referenced in the beginning, like I feel like we take braces for granted and we just kind of, like, when is the last time that I recommended someone to wear an ankle brace?
Yeah. A lot of times it's like, oh, well, if it fits in your shoe and you're all right with it, go for it.
I mean, honestly, I think it's mostly because I just know it's going to be so tough to get their buy-in. But if it's something comfortable, if it's something new, if it's something that, like, I have one athlete right now who is wearing an ankle brace that his physician gave to him. And it's not like one of those, like, lace up cloth canvas doesn't fit in your shoe, and I think that's the only thing that's keeping him wearing it.
It can be comfortable.
Right. And so this like new idea of like challenging the norms and like an elastomer rubber, like silicone-ish is a lot different than we're used to, and I think it could be the future.
Yeah, no, absolutely.
So again, if you are interested in checking out the brace that Dr. K was referencing and that we are referencing, head over to our show notes or our Instagram. Any of your purchases also do help support the show. If you're interested in hearing any of our other episodes, we do various episodes here on AT Corner. We have story episodes where we bring stories from athletic trainers around the world on a highlight topic. We have CEU episodes where Randy reads research articles and we talk about them conversationally. And those are good for category A CEUs for athletic trainers. And then we also have interview topics just like this one where we bring an expert in the field on their expertise.
Yes.
And I think that's all I got.
Thank you for helping us showcase athletic training behind the tape. Bye.